We call ourselves on purpose disruptive innovators, you know. We do disrupt practice as usual, but not just to play chaos games, but rather to recognize that technology will never substitute for the human-heartedness. It never will. But it sure can begin to re-engineer the kinds of conversations that are possible within the constraints of the 15 to 20 minute medication visit as it currently exists in America. What I try to do is to change what happens between psychiatrists and nurses and the rest of the care team or the treatment team and the individual. I create technologies that help to engineer a new kind of conversation. So when people use the software that we build, they are assisted through the software in finding and discovering their own personal medicine, for instance. And not only can the individual use that personal medicine for themselves, but it's also on the report that goes to the doctor and to the case manager and to the therapist. And it's informing the entire team about what I bring to the table in order to be a partner in my own healthcare. When people first use the software, the number one concern is side effects. The second concern about the meds that they're prescribed is that I'm concerned about how the medicines are affecting my health. And the third thing that they say is that I'm concerned about that the medicine isn't actually helping me. Top three concerns all over the country. And what we see is over time, as people use the technology and have these new kinds of conversations with their doctors and nurses, that those numbers drop. So people are not having as bad side effects. People are less concerned about how the medicine is affecting their health because they're communicating and getting the information they need and making better decisions with their doctors. And also, over time, people find that the medicines that they are using are actually being more helpful. And that has to do with the synergy between the personal medicine and the pill medicine, but also because I think people are communicating better and getting better dosages, which are optimized and are actually supporting recovery rather than working against recovery. So actual examples of how this begins to play out in the real world with real people. A woman had been living with a very bad side effect that's called akathisia, and it's a side effect. Well, let me put it this way. It's like internal torment, and it's hard to empathize with because it's not real visible. But this one woman had been living with it for many years, and she was way too afraid to speak up about it, and for two reasons. One, she didn't want to seem ungrateful to her doctor, and the second reason is she was afraid that her doctor would do something else and add more meds, including side effect meds, and she didn't want more because who knows what might happen. And through the use of the technology, she was able to communicate her concerns about this side effect, which, by the way, had gotten to the point where she was unable to work for 6 months. Now that's working against your recovery. Today she's back at work. Today she doesn't have that side effect. And to be honest with you, that's all I need to know to keep going somehow, you know, to keep going. When people discover that they can be an active participant in their own recovery and getting well, that's worth everything to me.